Hi, I'm Anissa Davis, the City Health Officer for the City of Long Beach, and I'd like to welcome you today to today's activities. Mental health is so important, especially during the COVID pandemic, which is causing unprecedented loss and grief, as well as social, financial, and educational disruptions. These times of upheaval and uncertainty are having an effect on everybody's mental well-being. It's causing more anxiety and depression for both young and older. As many as half of Black and Latinx people over the age of 18 report symptoms of anxiety and depression during this time. The economic hardship of job or income loss, the threat of illness or death puts you under a lot of stress and puts stress on your relationships with your loved ones and friends. It's been particularly difficult for those on the front lines, essential workers who work with those who are ill or who are unable to work from home. But I don't think anyone right now is being untouched by the mental effects of this pandemic. But even before the pandemic, mental health is something that's really important to your overall well-being. And just like it's important to do things to keep our bodies physically healthy, it's also important to do things to promote our mental well-being as well. And some of those things have been really difficult to maintain during the pandemic, such as getting enough sleep and getting regular exercise. And just like we would go to the doctor for regular physical checkups, or go if something's wrong with us, such as shoulder pain or chest pain, it's also important to reach out to mental health professionals to do a check-in for our mental well-being as well. And it's really important to address our anxiety, worry, problem sleeping, substance overuse, feelings of isolation or grief that you may be experiencing right now. I encourage everyone who's having difficulties right now in this pandemic that it's expected. However, you don't need to go it alone. There is help, and I encourage everyone to reach out for help. Thank you.
Welcome to all of you to this panel on the importance of mental health during this COVID time. My name is Kelly Colopy, and I'm the Director of Health and Human Services for the City of Long Beach. I'd like to thank you all for being here and for being open and willing to engage in this conversation and to help share and focus in the future with our community the importance of mental health. So we're really moving forward in a mental health campaign, and we're doing this to create a safe space to understand the process of reaching out for mental health supports. We know a lot of people are experiencing mental health challenges, and there's a network of support in our city to be able to support you and to support your family and other community members. We want to talk a little bit, we know that COVID has really impacted many of our communities in different ways, and that all of us are facing some type of challenge. But we thought it was important to really mention a few groups who are particularly vulnerable when it comes to experiencing mental health concerns. There's been a disproportionate impact of mental health toll on our older adults, women, and people of color during this COVID pandemic. Older adults have been greatly impacted as they've been asked to stay home and to remain home to avoid exposure. This has led to feelings of isolation, fear, and just a general feeling of being overwhelmed with all the changes and technology challenges impacting their lives. For women, many have had to leave the workforce or to work to meet increased responsibilities to support their children's education and caregiving while working from home. This is leading to increases in stress and anxiety. People of color have continuously faced injustices on countless fronts as they navigate through mistrust, access, and availability of culturally affirming services to uplift their mental well-being. COVID has only exacerbated the situation. We know that there has been grief and loss through all of our communities. There's so many people who have lost family members, friends, neighbors, people that they work with. And it's been very difficult to celebrate the lives of and to remember all of those lives because we know that funerals and burials and all of the other things that bring people together in celebration have had to change. And so everybody's had to work around that as well. We know that mental health is a public health crisis. So within the public health crisis of this COVID pandemic, we are also experiencing a mental health crisis as they're so connected. So we want to make sure that everybody knows that, not just during COVID, but beyond everything that we're doing, that this department, the Long Beach Department of Health and Human Services, is committed to mental health. Over the past 5 years, by integrating mental health supports into our services and sharing mental health supports on our website. These community conversations are just the next step in helping everyone across our city understand the importance of mental health and feel comfortable reaching out for the supports they need. So thank you all for being here. We look forward to working with you, and we'll look forward to hearing from our panel.
Welcome, Long Beach. How are you guys doing? I hope that you guys are doing well today. Greetings. We are so grateful that you would take the time out of your day to tune in and listen to how you can be investing and being intentional about taking care of yourself during these difficult times. We are here today to talk about ways that you can find resources in your community and offerings that are available to you, many of which are at no cost or very low cost for you and your family. And it doesn't matter what your age are, we have resources for all ages. And I'm really excited to be here with some experts, some thought leaders in the mental health profession here in the great city of Long Beach. And they're going to be introducing themselves in a moment. We're going to be going over some questions. We're getting a little vulnerable, a little authentic, and sharing how this pandemic, COVID-19, has been impacting us as a community collectively, and then as individuals. So I'm happy to have here with me today Arturo and Stephanie and Sandra, and they're going to share a little bit about who they are and the work that they're doing here in the city of Long Beach and the organizations that they're with. So Arturo, would you kick us off and please introduce yourself?
Hey everybody, my name's Arturo. I'm a licensed marriage family therapist. I'm the site supervisor at the Long Beach Trauma Recovery Center. We have an office on the St. Mary's campus and on Cal State Long Beach. We're a partnership with Cal State Long Beach. At this point, we're all on Zoom, so we're not in the actual office, but that's where our office was previously and will be located after all this is over. But glad to be here.
Thank you so much, Arturo, for taking time out of your day to be with us. Dr. Sandra, would you mind sharing?
Hi, I'm Dr. Sandra Hardy. I'm a clinical psychologist and marriage and family therapist. I grew up in Long Beach, so I know a lot about Long Beach. I come from a large family. I have a small practice in the Bixby Knolls area, and doing some work specifically with African American family, providing some free mental health services. And most importantly, I'm just glad to be here and see how we can help make each other the best we can possibly be.
Thank you so much, Dr. Sandra, for being with us.
Welcome.
Stephanie, would you please share who you are with?
Hi, everybody. My name is Stephanie Kimelik. I'm a licensed clinical social worker with the City of Long Beach in our health department, and I am the Strengthening Families Program Manager. So I oversee our family preservation program, where we work with families and children. And also I oversee our Fundamentals of Fatherhood program, where we, of course, work with fathers and their families. Super excited to be here today.
Thank you for joining us. So before we get into some of the questions that we want to share with the community, we want to ask you guys kind of a personal question, and we're grateful that you would be vulnerable with us. So the question is, describing your own personal challenges in these last 10 months and how you have coped with those challenges, right? No one is exempt, right? We've all been touched, some more than others, but we've all been touched by this pandemic and by COVID-19. And I think although, yes, you have the credentials and yes, you're professionals in the field, you're also human, right? And you lead lives and you have families, and you too can be impacted. So if you guys would share a bit about how these last 10 months have been for you and how you've been coping. And Arturo, I'll turn to you to start us off.
Thanks, David. Yeah, I mean, obviously the pandemic, nobody expected it. So I think there's just, in general, a lot of unknown. We thought maybe it would be short, then it kind of got longer, things got worse, things got better, then they got worse again. So I think there's a lot of sort of uncertainty, just a lot of needing to kind of retool, having to get everything to be online to provide and transition all of our services. To be completely, driven through sort of video conference was sort of like an extra load to just work that we normally do. And then at that point, just personally, like I have a 1-year-old, so he was in daycare. So right when the pandemic came out, it's like, do we leave him in daycare? Do we bring him home? So we brought him home for about a month or two, just trying to figure out and, get our feet on the ground of what's going on. And so I kind of had to juggle multiple things at once, right? It's like I have my regular job, and I have added sort of responsibilities to try to put all our services on Zoom or video conference. And then I'm trying to do that while trying to watch a 1-year-old at the same time. So it was just overwhelming. I couldn't really sort of focus on doing my job well. I couldn't really focus on being a good dad. So I was just sort of spread thin. So, me and my wife had to have that conversation of like, how do we want to do this after things kind of looked like they weren't going to get better soon. We decided to, put them in daycare. They have their own protocols. We were being as safe as we could as well, to kind of get some balance. And then I had to kind of step up too and let my wife know, hey, there are times when maybe I need like half a day or a day to myself where either I just work in the garden or I do a little bit of woodworking in the garage, so I can kind of just clear my head. We're all at home at the same time, so it can be a lot, and it's something that we're kind of not used to. So I had to kind of step up and be able to say what my needs were, be able to take time for myself when I need it. We sometimes maybe we don't want to. I want to be there all the time, but we really need to step back and take our alone time. Or at least for me, that was something that was helpful. And I'm still trying to kind of work on that.
Thank you so much, Arturo, for sharing that. And I'm sure that was very challenging for you, but it sounds like you're doing the best you can and that you're making a way. You're resilient.
Yeah.
Stephanie, would you mind sharing?
Yeah, so at the beginning of the pandemic, the first thing in my life that got out of whack was sleeping. And that's a common sign for me that something is going on. When I have trouble sleeping, I know I got to look at my life and figure out what's happening. And I think it was just to Arturo's point, all the unknowns. It was very scary. And we just didn't know enough about anything. And so feeling out of control, feeling like I didn't know what was going on, feeling like not a lot of people knew what was going on, feeling very uneasy. I was having a lot of trouble sleeping. And so I looked back on the things I know that helped me in the past, right? When my sleep gets a little out of whack and I'm dealing with some of that anxiety. And it was just kind of this constant bubbling of anxious energy under the surface, right? Just always. It wasn't like I'm having an anxious day, I'm nervous about something coming up. It was just this bubbling feeling of unrest that I had. So exercise is really helpful for me to make sure that my body is physically tired so that I'll have an easier time sleeping. So that's one thing I made sure to really try to get in there as best I could. And then I was taking advantage of some of those meditation apps that at the beginning of the pandemic, they were offering for free. So the Calm app and the Headspace app were really helpful for me to do some guided meditations, not only to help me sleep, but also in the morning to start my day on the right foot with kind of a morning meditation. So those are some things that have kind of helped me manage throughout the last few months.
Thank you so much for sharing, Stephanie. Yeah, absolutely. I am familiar with those apps. I use those apps too, and they were wonderful, especially around the meditation and being able to help ground and find centering in a day, especially if you're feeling anxious. So thank you so much for sharing that. And Dr. Hardy, we get to you. We'd love to hear from you about what have been some challenges over the last 10 months and how you've been coping.
I think the biggest challenge was to work on not blaming my husband for everything, because it's so easy, he's the closest person. So when I would feel, anxious or upset or disappointed or whatever, to really realize that we're a team and we're going to be in this, we live in this space together, and we better try to figure out how to get along and how to make each other good, be a good support for each other. So in the beginning, we did some things. We would do Bible study in the morning. We started off really good, just, kind of fortifying ourselves so we'd be ready and able to deal with things. I think gradually we've kind of moved away from some of that, some of it because we've just gotten better and gotten used to it a little bit. And then I think what's been really a challenge though is that not only did we have the pandemic, but then we had all the racial inequality issues that came up that brought up a lot of trauma and a lot of different feelings. And then we had this, what I consider this wild political system where we were divided as a country and turning on each other. And so there were so many facets to it that it became hard. So in the beginning, I remember one of the things I was telling my clients is to give yourself permission to kind of break down, to feel it, to experience it, to go through it. And then once I did that, I started to feel better, that I acknowledged it and gave myself permission. And then gradually it's just that the whole idea of self-care, that there was nobody coming to rescue me, I've got to figure this out. And so we really put a lot of time and energy into taking care of myself, being thoughtful, being prayerful, being concerned about others. And then one more thing was that I made a decision to look for the good, because there was just so much information coming at us all the time: news, politics, injustice, pandemic, fear. Just look for good. And so I made a conscious decision to keep looking for good. And then finally, I think after about a year, coming up on the new year, I realized just recently that I'm going through the pandemic too. So busy helping other people and figuring it out, that to realize like, hey, wait a minute, I'm going through this. So now that I've acknowledged that, I'm going to take some time off. I'm going to do some more things. I need to do more self-care than I thought I needed to do. So I'm still in the fight, and we're in here together. We're all, we keep working together. We'll figure this out. We will get through it. So we just have to keep working at it.
Absolutely. Thank you so much, Dr. Hardy, for sharing. I want to ask you guys and talk a bit about, if I'm someone listening and maybe I'm on the fence, or I'm living in this tension of man, how do I know that it's time to call, or that it's time to seek out resources for mental health? And what do I do? Maybe I'm in that place, and some of the things we've shared here, your relationships are strained, and you're having a hard time concentrating at work, and maybe you feel like in the parenting area of your life, you're not doing as good a job as you can, because you're trying to also be a parent and a teacher while your kid is learning through Zoom at home with distance learning. How do I know when it's time, or that I should seek other resources out professionally, or maybe even in the form of in community, and maybe a support group or something?
One of the things I would say to take some of the guesswork out of it is, if you lived through 2020, don't even worry about it. Just reach out for help, because we all need help, so we don't have to think about, am I crazy, or what's going on, but ask somebody for help. I mean, if you've got it all together, then reach out and help somebody else. But I think it's just, we can just know what we've been through or what we're going through, that reach out for help. And I was thinking about it, that maybe we need to even work on not calling it so much our mental health, but just, how are you doing? How are you feeling? What else is going on in your life, so that we begin to maybe break down some of the stigma that you've got to be mentally ill, or there's got to be something really wrong with you to ask for help or be of help. That we've all gone through something pretty traumatic, and just, so there's different kinds of help, obviously, but start with the people that are close to you, and they'll let you know for sure. Though my family lets me know when I need more help or it's not enough. But I think if we can just know that we need each other and we need help right now, and it's okay to ask for help, and that if you're not, almost maybe we can do it the other way. If you're not asking for help, maybe those are the people that we need to be concerned about. That you're not asking for help, because all of us are needing help and support right now.
Thank you so much, Dr. Hardy, for that. Stephanie, Arturo, you guys want to chime in and share anything on this?
Well, I definitely echo Dr. Hardy's sentiments that absolutely everyone can benefit from mental health services, whether that's counseling or a support group, whatever that might look like in general, but especially because of what's been going on the last year. But some signs or symptoms, at least, that can sometimes let you know, like, okay, I understand we're all going through it and it's been a stressful year, but I'm holding it together, or I think I'm holding it together. Am I holding it together? Maybe I'm not really sure.
Yeah.
So for me, as I mentioned earlier, the sleep. So any interruption in your normal sleep pattern might be a sign that there's something more going on. Eating, whether that's eating too much or eating less than you normally would. And I know we're all, home, so we're maybe eating more just because the food is readily available. But if it's something that you feel like you're going to cope or to zone out, that might be something. And then to Dr. Hardy's point, stating that there's people in her life that will let her know, hey, I can tell something's going on with you. Let's get this figured out. Not all of us maybe have as in tune supports in our life, but it's okay to ask those people. They might not feel comfortable or might not be as hyper aware to say something to you. But if you can ask the people that you really trust, I'm feeling really off. Is it just I'm having a bad couple of days, or is this normal? Or do you think maybe there's something more going on, or should I get more help? And then they might go, yes, I've been meaning to tell you, but I was worried how you'd react. And I just really think that you could be feeling a lot better than how you're feeling right now. And you deserve to feel better than you feel right now. And there is support out there to help you with that, and take advantage of it. So pay attention to your normal patterns, any change in those patterns, and then ask the people that you trust. What do they think?
Yeah, good word. Reach out, right? Reach out. Don't be afraid. I like to say, that we suffer in isolation and we begin to find healing in community, right? And it's really important that we press in and lean into that community. So I'm grateful to hear Dr. Hardy and Stephanie, you both say. Arturo, I'm going to switch it up on you. I got a question. Working at the LBTRC, I want to give a shout out. You guys do great work. Maybe there's people listening and they're saying, I have talked to some friends and they said that maybe I could use a little help. Maybe I do need a little help, but I'm not so sure about therapy. I don't know that I want the one-on-one model. Or what are some alternatives for people who are not interested in therapy right now, but they know they need something?
Sure. Yeah, I think there's a lot of things that are helpful in healing. As therapists, as psychologists, we don't hold the only key or the only path to healing. So, as you mentioned, there's lots of apps, things like meditation, mindfulness is really helpful. So that kind of really helps people just kind of find an even keel, reduce some of their sort of ongoing stress. There are a lot of sort of groups that you can attend. A lot of them obviously are on Zoom at this point. So if you can kind of, sometimes they're drop-in groups, sometimes maybe it's for 6 or 12 weeks, depending on the issues that you're dealing with. You can attend groups. There are hotlines, warm lines that you can call. Hotlines are usually for crisis situations. Warm lines are maybe not as like an emergency situation. So there are definitely other things. There's books that we can read. We can do things like exercise and self-care. People just kind of like to really do art, they paint, focusing, giving yourself something, filling your own cup in some way is, really helpful. So there are other alternatives I've heard too and have seen. There are sort of online support groups that are, sort of completely confidential that you can join and talk about certain things, and people don't know, your real name. So there are sort of different ways to access all kinds of help.
Absolutely. Thank you so much for sharing that. And if you're listening, I think it just starts with one small step.
Yeah.
Right? I think sometimes we can feel overwhelmed by this whole idea of 9 weeks or 10 weeks or 9 sessions. And if you're in that place, I think it's like anything in life, when we want to create a healthy habit or create something in our life that's meaningful, it's taking that small first step to doing it. So it could be calling the warm line, right? It could be downloading the app. maybe it sits on your phone for a week, right? Before you actually open it up and create a profile. But the point is you're moving in an intentional direction towards seeking out support and finding help. And I want to remind our listeners that I know we're sharing a lot, but there definitely will be links to some resources here in the city of Long Beach for mental health resources and everything we're talking about. So those will be ready available to you as residents. I want to move to this next question. And Arturo, you touched on it a little bit, but what are some of the barriers, I think, to getting therapy, right? We know even culturally, and sometimes there's these things in our lives that create barriers to accessing services. And then what would that first step look like for someone who says, yeah, I like what you're saying right now, guys, and I'm in, I want to do it, but I got a barrier and I don't know what that first step is. Can you guys paint a picture for them?
I think a huge barrier for many is cost. Therapy itself is just labor intensive. If we think about sort of just how it functions, it's a person who's been trained and educated in a certain way, and that takes a lot of time and energy, but it's only one person. And then we see, it's a one-on-one thing. So it's very labor intensive, can be very expensive. And so I think that is a huge barrier to a lot of people. The cost, sometimes it can be anywhere from 60 to 150, upwards to 250, 300 an hour. So that can be a barrier for a lot of people, especially people of color, people in lower socioeconomic circumstances.
But it sounds like, Arturo, I know for sure with Dr. Hardy here and having you here from the LBTRC that we already got 2 resources right here for people in our community that if they want to access pretty much low to no cost mental health services, they can do it both through your agencies.
Yeah, so Long Beach Trauma Recovery Center, our services are completely free. The only requirement is that you've experienced, you've been the victim of a crime, or you've experienced a traumatic incident in your life. So our services are 100% completely free. The way you get in touch with us is either through our website. I would just Google search Long Beach Trauma Recovery Center. And so that's one way. We have a schedule a consultation button on there, or you can give us a phone call and we can get you set up with your first appointment, which is a consultation to kind of make sure that you're the best fit, that we can provide you what you're looking for. It's about a 30-minute appointment, and our number's 562-985-1366. So our services are completely free. We have a wait list. It's maybe about 2 or 3 weeks long, which is not very long at all. And so we're ready and just willing to help anybody who wants to reach out.
Thank you so much, Arturo, for that great resource. And Dr. Hardy, you having your own private practice, Arturo is part of an organization. Maybe you can share with our listeners, hey, I'm interested in therapy with an individual therapist. What does that first step look like? And what is a typical first appointment look like for a new client?
Well, in my private practice, I work primarily with people who have insurance.
Okay.
And so one of the first ways that someone can access therapy is to maybe call their insurance and, tell them what they're looking for. And sometimes people don't know. You can say specifically, I'm looking for a therapist who's African-American, who's Asian, you can ask, I'm looking for a Christian therapist, I'm looking for A, B, or C, and don't be afraid to at least ask. We have not because we ask not sometimes. So at least ask for what you're looking for and see if they can provide it. Secondly, through the CARES Act in the city of Long Beach, we're providing free mental health services with, and there's no cost. The particular program that I'm a part of, it goes through the end of April. So that would be important to give us a call. You can call me at the Center for Best Living, and my number is area code 562-673-8817. but I'm not the only one that's participating in the program. There are at least 4 other agencies or therapists that are participating. So we're trying to provide services that are free of charge, at least through the end of April. And perhaps as we look at doing this, this has been an opportunity for us to restructure a lot. And so maybe something good that's going to come out of this is a realization that we need to restructure the way we've done mental health and provided services and made them accessible to people differently than how we've done in the past. But we do teletherapy. One of the things I found that teletherapy is helpful, and a lot of people are more inclined, actually, you can do it anonymously. You're at home. You don't have to worry about getting in the car, finding a babysitter. You can call up and, set up an appointment at the right time and be able to see someone. Let me think what else. An intake, a usual intake. We don't spend, maybe an intake may take and not even an hour. It just depends on what the issues are. So I like to spend most of my time getting to know the person that I'm working with. And so we do our intake in a more informal way where I'm getting information, but we're getting to know each other. And so the Center for Best Living focuses on trying to help you just live your best life. And we try to make it have as few barriers as possible. So when you walk in our door, whenever we come back to seeing people face to face, or when you call, our goal is to try to make you feel as comfortable as possible. And regardless of who you are, where you come from, that everybody is treated as if you're royalty. When you walk in, when you're with us, we treat you like we treat family. So hopefully
well, thank you so much, Dr. Hardy, for that information.
I just wanted to add that for folks in Long Beach that are not insured and not sure if you qualify, the City of Long Beach Department of Health and Human Services does have an office that can assess to see if you qualify for Medi-Cal or another type of health insurance, where then you could have more access to mental health services. And so you can call 562-570-7979 and do an assessment over the phone. And even if you've tried that before and you didn't qualify, my understanding is that some of the income thresholds have been increased to make sure that more people can be covered. So it doesn't hurt to call again and see if you may now qualify to get coverage through that insurance. Thank you.
Wonderful piece of information, Stephanie. Thank you so much for sharing that for those listening. We got a lot of parents, I'm hoping, listening. Arturo, you already said you're a dad. I am a dad. I have a 7-year-old son at home. I don't know if Dr. Hardy or Stephanie are parents, but how can kids who want support get help, right? There's a lot of kids, maybe elementary school, middle school, high school, maybe even preschoolers. How can they get support? How can they get help? And what are some of the concerns around ability to consent, right? I'm a minor. Maybe I want to get the services, but my mom or dad aren't letting me. I don't know who's listening, but we want to make sure we address these things. Who would like to share a bit about that? Maybe Stephanie or Arturo, would you like to speak to that?
Sure. Yes, so there is, at the Long Beach Trauma Recovery Center, we have some project sites or sort of like satellite offices. So we do work with high schools in the Long Beach area. So we have a therapist who in the past would be there on campus for a day a week. And so we work with Milliken, we work with Jordan High School. We also work with Jackie Robinson Academy. In other schools, we're trying to get some other schools on, to help out. So we take clients from there, kids that are referred by their school counselor. So if kids are wanting to seek help, one sort of starting point is their school counselor, their school psychologist that they can speak to. And then there is, it's a little bit complicated, but if somebody who's older than 12 wants to seek services, and either their parents don't want them to, or some other reason, there's some barriers for them, they can consent for themselves to receive treatment. There is a little bit more of assessment that needs to happen, kind of what exactly is going on. Are they in danger? But it is possible for a child who is 12 and above to consent for their own services if it's deemed necessary. So that's a good thing. We know that there are lots of different barriers, cultural, religious sometimes, and so sometimes kids can access the services on their own.
Thank you so much for sharing that, Artur. I think that's a really good piece of information for people to know. And I also think it's important to touch on, for students who are within the LGBTQ plus community, how can they seek out supportive services during this time?
So actually, Long Beach has an organization called the Center, and they offer services. It includes support groups, individual counseling, group therapy. They have a ton of great services for people who are LGBTQ plus, and they actually even have some peer-led groups. So sometimes, teenagers are like, what am I going to do? Go sit in this group with some older person that doesn't know my experience? And oftentimes they'll have fellow peers who are, trained to help facilitate those groups. So it feels a little bit more comfortable and more of a supportive environment. I want to also empower our youth to advocate for themselves regarding what you might feel most comfortable with. Dr. Hardy mentioned earlier that if you wanted to request a specific race or gender for your therapist, you can do that in terms of LGBTQ plus as well. But yeah, if you want someone who is more like you, or maybe you want someone who gives you more of a grandmotherly vibe, whatever might feel best for you is what you should advocate for. And you might not know what that is. So you might just say, I just know I want to talk to someone. And you might start talking to someone and you might not feel a connection. I want to encourage that you give it at least a few weeks, right? Because we have to get to know someone and give everybody a fair shot. But if you've given it a few weeks and you're still feeling like you're having trouble connecting with that person, whether it's a therapist or a counselor, it's okay to ask for someone else. And maybe through that conversation or those conversations, you'll kind of be able to determine who you might feel more comfortable with. And it's okay to say that. As therapists, we do not get offended. I promise. We do not get offended if someone says, hey, I had someone who said, you know what? You remind me too much of my daughter. I just don't feel like I can really talk to you about my issues. No problem. I totally understand and happy to refer to someone that you would feel more comfortable with.
I would just like to add, I think mostly for the adults, but please pay attention, because if we think about when we introduced ourselves as adults, we said how we've been going through, we've gone through phases and how it's been hard for us. Imagine not having a car, not having probably a lot of money, not having a good support, being able to see your friends at school. So our kids we really need to be paying attention to them and asking them questions and being there for them, because I just imagine, I often think about, when I'm talking to a parent about their 10-year-old, and I'm reminding the parent that this person has only been on the planet for 10 years. They need help. They're not going to know how to figure all this out. And so as adults, we really need to pay attention. And I think now that this has gone on for a year, we need to ask them again. We need to be paying attention again. What is it? How can I be a better support? And it doesn't have to be, are you having problems? But how can I be a better parent, sister, brother, uncle, aunt, friend, teacher? How can I help you? Is there anything you need my help with? And then also, I think it's important to ask kids. Sometimes they can help us. Help me out. I'm trying to figure something out, or I'm struggling. What's your thoughts about this? So I just wanted to put that plug in there, that we really need to be paying attention to what our kids are going through and how hard this might be for them. Another thing I thought about, I'm not going to keep going, but I thought about this morning, that where kids used to they used to be able to use their video systems for fun and to get away from parents. Now these video systems are used for school. And so they're probably tired. It's like something they used to be able to escape to and use. Now it's being turned into something you have to use for education, and you're on it all day. So I don't know, being creative and paying attention and letting them know how important they are is really, really critical right now.
Absolutely, absolutely. Thank you, Dr. Hardy. Yeah, it's okay not to be okay, right? And you know, there's talk now with potentially schools reopening up and going back, and that can add added stress and anxiety and exacerbate it. And I think it's important to have those conversations. What do you need to feel supported if you do go back to school? I was talking to my son this morning, and he told me, you know, Dad, I'm kind of scared to go back to school. Like, I don't know if I want to go back to school. So we had to have that conversation and unpack that. And I'll be honest and say I didn't have all the answers. And I was willing to say, you know, let me get back to you on that. I don't know, son. And I think it's okay as parents to say we don't know, right? And that's why there's professionals like you who we can reach out to help, you know, find some of these answers and to get the support we need as parents who are raising, as you described, Dr. Hardy, these 10-year-olds who've only been on planet Earth for 10 years. So, because here we are, been on planet Earth for, you know, 30, 40, 50 years, and we're still trying to figure it out. So I think that's really, really sound feedback. Thank you. So I'm going to talk about the big T word, right? The big T. It's a buzzword these days, trauma, right? Trauma. We've been hearing this word for a few years now, trauma-informed care. Maybe people listening know what that means, and maybe they don't. I know we've been working really hard as a city and through the health department and LBUSD to get everybody to become trauma-informed. I know specifically the LBTRC has done work with our police force to help officers become trauma-informed, and it's important as experts in the field. But we want to talk about it today, I think, at a low level, in the boots on the ground, right? Like, how is trauma impacting residents and families and communities? And so would you guys mind speaking to it around how this idea, and we can have intergenerational trauma as a result of systemic racism, the pandemic is trauma, all these things we're experiencing, how it looks in the communities you're working with right now.
As you mentioned, generational trauma that gets passed on through generations. We're seeing layered levels of complex trauma as a collective community. So the pandemic, the racial injustice, the political strife in the country, people losing their jobs, people losing their family members. It's just compacted and compounded on top of itself. And so it's very complex, it's very layered, and it's a lot to kind of slog through, right? And which is why we're encouraging you all to reach out for help, because no one can be expected to get through all of these different things alone. I think one of the main ways, and I'll let Dr. Hardy and Arturo also, you know, speak to the people that they work with, but something that I am seeing a lot with the people that we work with is we started out the pandemic kind of high stress and high tension, and how long is it going to go for? And now it's just kind of kept going and kept going. And is this our new normal? And it's almost this sense of like, I can't think of the word. Hopefully you'll edit this out, but not complacency, but almost like acceptance, or just, you know, that feeling of like things
defeated, and maybe defeated a little bit.
Yes, yeah, just defeated with like, where is the hope? Where is this going? What is life going to look like? How are we going to come back from this? And the way that I see it on the people that we work with, how I see it on the faces is almost just like flat and tired. It's not necessarily presenting always as crying and so upset or highly activated and stressed out, but almost just like a flat kind of non-reactive, like I'm just giving up, or I'm just trying to like get through. And I'm just kind of like, yeah, defeated, I think is the perfect word.
Yeah. And maybe a little bit of what you're seeing too is this idea that I'm just numb, right? I'm just numb to all that's going on. I'm over it. I've had it. I'm going to do what I got to do to get through today. And that's that. And I love how you said new normal. I've been using this term called new now, because I feel like it's changing every day. So as soon as you redefine the new normal, you're like, wait a minute, there's new variables here. So now it's my new now. And if the new now is always changing, right? And the goal line is always being moved on us, we feel like we can never make a touchdown. So we're like, well, just put me on the bench, coach, because I'm done. I'm defeated. Let someone else go play for me. So I appreciate that. Dr. Hardy, Arturo, kind of, speaking to how it looks in the communities you're working with, trauma and all the things we experienced through this pandemic.
Yeah, I would say we serve a lot of sort of monolingual Spanish speakers, people of color, lower socioeconomic circumstances. So we know that the pandemic has, hit them harder, that many more have been infected. So unfortunately, we have seen many clients who have lost loved ones. Some maybe had, some of the pre-existing conditions and, maybe it could have been a little expected, but many were, sorry, cat. A lot of people many people just, it was completely unexpected. These people were healthy. They didn't know that, they weren't sure how this was going to all go down. This person gets it, or the whole family gets it. Everybody else is okay, but maybe it's a parent dies, or maybe a sibling, or maybe an uncle. And so we have seen a lot more people reaching out who have lost loved ones. And then obviously, especially focusing on trauma, we see lots of people who have histories of trauma, usually an average about 6 to 8 traumas when they get to us, or traumatic experiences. And then they have this other traumatic experience that's sort of added on to the pile, which can exacerbate symptoms or make symptoms come back. And so we've seen a lot of that, a lot of people reaching out for help for those reasons as well.
Add to, I think in the African American community, a lot of what we've historically called dysfunctional behavior is, people trying the best they can, not making excuses for bad behavior, but people trying the best that they can to make the most out of what least they have, And so we've labeled it as dysfunctional when really much of it is people's, person's attempts to try to make sense of having been through so much. And one of the things that I've noticed, I mean, we have all the, it's pretty well known. We, in the African American community, we have all the traditional symptoms with our bodies, our health, sometimes with our relationships, our families. At the same time, I think one of the things that I've noticed is that there's some real resilience in our community, and that how we've historically been through so much in this country that we have, in many ways, this is just another trauma, another thing that's been added onto our lives. And I think one of the things I'll say personally, one of the things that I've noticed has been beneficial to me is to be able to label things a little better now. That there's been a lot of talk about structural racism, where historically that's not a term that the typical person hears all the time. And it's almost a relief in a way to have it acknowledged, but it really is. There's a structure that's contributing to and continues to reinforce some of the dysfunction and the disparity that's in our country. So as you can see, this is really important to me, but yeah, there's been some being able to talk about it, to read about it. There's so much literature out there. You're seeing an emphasis on African-American performers and art and culture, and you're seeing we're being given the freedom to express more. And so in some ways, it's opened some doors that have been closed. So there's this interesting kind of dichotomy, but we're talking about it more. And I think that's really, really important. As you can see, it's just below the surface a lot of time for many people and for us. And then as like Arturo and Stephanie were talking about, the different layers of trauma. I mean, how many people, when we talk about the thousands of people who died in this last year, those are our relatives, our friends, our family members, our clients' family members. So, it's hitting home. And so we just realized that trauma is there. And again, I just keep coming back to, we need each other. We gotta do better.
Thank you for sharing and going, a little deeper, right? And I could see that struck a chord with you. And I am deeply grateful that you would share that with us. And you kind of segued greatly kind of into our next question. As we're filming this today, yesterday marked 500,000 deaths to COVID-19, and we got to pause and you got to think about that. You named it. Those are wives and husbands, and siblings and grandparents and friends, and coworkers and neighbors, and even clients, right? People we serve and people listening. And so I just want to acknowledge that. And I don't think we can have this conversation without addressing grief and loss, right? I have the honor and pleasure. I serve as the executive director at New Hope Grief Support Community here in the city of Long Beach, and our mission is to bring hope and healing to the lives of grieving children and families. And so we've seen a huge influx in calls and emails coming in, and so I want to talk to you guys too, because you guys are co-laborers, right, in the field, and you guys are working with a lot of people. And so how is COVID impacting the grief and loss in our communities and communities you're working with, and the people you're seeing in the lives that you're touching? And what are some ways that people can begin to process this, recognizing, right, that the way in which our society has normally grieved, right, having memorials and funerals and all these markers that either A, are not happening at all, or B, are looking very different, very, very different. So I open the floor to whoever would like to kick us off around this.
Well, I think, David, one thing that, as you know, I think one thing that can make grieving difficult is when it's unexpected. And so a lot of times the pandemic was unexpected. We didn't know it would be like this. We don't know if it's going to get worse or get better. So that's sort of one piece that makes it extra challenging. Another piece is, many family members maybe didn't have an opportunity to say goodbye or to be physically present, when a family member dies. If they were in the hospital, not allowed to go to the hospital. So that really kind of throws a wrench in somebody's sort of natural process of going, it takes some time for us to kind of fully accept and absorb that this person is dead and that they're no longer, with us in this life. And so the pandemic has thrown a wrench, and it makes it difficult for us to kind of be present at those moments that would help us to start to begin that process. And so I think, it's challenging. It's really a challenge.
Thank you, Arturo. Yeah, absolutely. The calls we're getting, right, that's the challenge. They didn't get to say goodbye, or they say goodbye through a tablet. My mind also goes to the nurses and the healthcare workers who were not trained, right? That was not what they signed up for. And so now they're experiencing loss and trauma from being this liaison for end of life. Anyone else, Dr. Hardy or Stephanie, like to speak to kind of how this grief and loss is impacting our communities?
I would say that people are, like you, I think both of you mentioned that people are being creative. They're finding different ways to, traditional, again, very traditional ways in which we grieve and we mourn are having to be restructured and looked at from different ways. And I think I've seen people be really creative, from what a repast looks like to handing out gift cards to go and buy a meal after a funeral service, or people having to wait for weeks to bury their loved ones, and figuring out ways to make it happen and just being adaptive. I've had lots and lots of conversations around grief, and so helping people to kind of develop their philosophy or their awareness around grief because there's nothing, we're not going to be able to escape it if we can, there's no way. All of us at some time or another, the only way we can escape it is through our own death. And even that becomes a form of grief for someone else. So we have to begin to talk about it and think about it and, have some ideas about how we feel about it. To work through it, it's bringing up, what I'm seeing is that it's bringing up, I think Stephanie had mentioned layers, but it's bringing up grief from childhood or unresolved issues around a loss of a parent, but just trying to normalize it. And I have to say, I'm one of those people who are referring people to your agency, David, because it's better. I've come to understand it better. Like you said, we heal in community. That one of the things I've realized is that if we personalize it and only make it personal, it can become overwhelming. But when we share it and when we're part of something, we begin to see the universality of grief, and we can do it together. And it's done a lot better, even though that's scary for a lot of people. It's a lot better when it's done in community.
Absolutely, absolutely. Thank you for sharing that. Yeah, and I'll just share a couple things in grief. We say here at New Hope is, number one, you're not going crazy, right? Yeah. Number two, everything you're feeling is normal in grief. It's a normal grief response. And third, I think everyone, if we could all do a better job of this, is giving people permission to grieve.
Yeah.
Right. It's not like, hey, take 3 days off work. And in this case, don't go bury your loved one and then come on back.
Yeah.
So it's giving people permission in the space to be able to grieve in a way that they need to, because everyone's grief journey is different. It's as unique as a thumbprint, right? No two people are going to grieve the same. So I appreciate that, Dr. Hart. Stephanie, would you like to add something?
Yeah, and I know we're already over time. So I just wanted to quickly add that to your point, we all need to be allowed to grieve in our own way. That yes, we all collectively experience grief in one way or another. It's unavoidable throughout our lifetime, but that we are all going to experience it differently, act differently, think about it differently, and feel differently. And again, it's all okay. I also want to point out that grief isn't necessarily just related to death, right? We can also grieve the loss of the sense of security that we may have experienced over the last year, that we can grieve, the loss of a job or a relationship, or any major loss in life doesn't have to just be the loss of a loved one to death, but it can be moving and not being able to see our family that we typically get to see because of traveling, or because they're elderly and compromised and it's not safe for us to see them. We can grieve the loss of that interaction. So I just want to also normalize that grief can encompass a wide range of things, and that if you're feeling that sense of discomfort or loss or whatever, however that presents with you, that again, it's okay to access help and support for that.
Thank you so much, Stephanie, for addressing that and sharing. That's so important, so important. You guys have been amazing. We're gonna kind of be closing out our time, but I think where I want to end in this is, we've talked about trauma, we've talked about grief, we talked about, identifying a support system, identifying therapists and accessing services, some at no cost, free, and some to low and minimal cost, and things you need to do and steps you can take. But I want to talk and have you guys close out. Each of you, if we share a bit just about resiliency, right? This idea of being resilient, and everything we've talked about today, for the most part, feeds into that idea of resiliency and self-care and wellness and well-being. But if each of you would just, take a moment to drop some gems and leave us with some nuggets around resiliency, we'd appreciate that. So, Dr. Hardy, why don't you kick us off with that?
I would just say that we've been through hard times before. I mean, in this country, in the world, we're living through this phase right now, and it feels like the worst possible thing that we could go through, and we are going through a hard time. But we're a resilient people. We are stronger than we think we are. We are weak at times, but that doesn't mean that we can't find our way. We know how to make. I remember something my mother would say, you know how to make a way out of no way, okay? So we take a little and we can find our way, and we will find our way through. We have more than we need. Most of us have more than we need, and we will get through this. And if we work together, we might even get through it loving each other more. So it's up to us to decide how we want to do it. But the other thing that my final word is, I've been trying to simplify this, and the word is love. That's, we need more. So even if you love more.
Thank you so much, Dr. Hardy.
Yeah.
More love. Stephanie, why don't you please share with us a bit about resiliency?
Yeah, absolutely. I think if you're watching this here today, that means you made it through the last year. You survived, and so you are resilient. That means that you have the ability to go through something that we have not experienced for many, many, many years, something that we collectively are going through as the world, right? It's not even just the United States. Worldwide, we've all been experiencing this collective trauma, and we're getting through it. And it's not easy, and it might still get harder, but we're getting through it. And I just want everyone who's watching this to know that you are cared about. I don't know you, but I care about you because you are human. And everyone in this room, I know, will agree with me. And we do this work because we care, and we want people to feel good, to feel better. Everybody deserves to feel good, to be happy, whatever that means for you. And that's what we're here to do. And you deserve it.
Thank you so much, Stephanie. Well said. And Arturo?
All right. So resiliency, I think also what's important about, we hear that word often sometimes. And sometimes we can think that resiliency is inherent, or somebody is resilient and somebody isn't. But resiliency is something that we're taught and that we learn. So it's important, to kind of know that we can always improve on resiliency, always improve our coping skills if we're given, sort of the right resources. And I think it's important to kind of just know that, we can get through this together, and that the things that we do, sometimes people are really critical. We can be our worst critic about maybe choices that we made in a certain circumstance. But usually, the choices we made is the best decision that we could come up with at the time, and our circumstances that we're sort of surrounded by. So I think if we felt like we made a wrong decision, to really look and see that maybe that was the best decision for us at the time. Maybe we didn't fight back and do something miraculous, but maybe sort of, freezing or just protecting ourselves at that time, it was sort of the best decision for us, the safest, thing that we could do at the time. So just really go easy on yourself. Know that everybody wants to, do the best for themselves, and we all try. And so just really looking for the positive, not critiquing yourself and decisions you made. So we can critique ourselves to death sometimes. So.
Dr. Hardy, Arturo, you guys have been amazing. We're so grateful that you guys took the time to be with us here today and to share not only your own personal struggles and journey through this pandemic, but also sharing your wisdom and your knowledge and your experience and your expertise with our city and residents here in Long Beach and beyond, I'm sure, who will be listening. And so, yeah, I love it. Arturo, give yourself grace.
And to find out what mental health services there are in the community available to you, to get that list of the hotlines, the warm lines that we talked about, you can go to longbeach.gov/mental health. And there's a whole resource guide available to you with all of the phone numbers, email addresses, hotlines, warm lines, anything that you could need. And it's broken down by age, if you have insurance or you don't have insurance. So it's very clear and easy to access. longbeach.gov/mental health.